However, if you're like me, you do need a doctor because I have a look in my mouth. I have no idea what's going on. So I call my buddy, Dr. Bobby Birdie. He says, Tom, you're not brushing correctly. It's a good start, right?
That's right. It's a great start.
Yeah. Dr. Bobby Birdie is with us from BC Perio. And we get together about once a month and we talk about implants. Somebody's just tuning into the show. Bobby, what are implants?
Implants are tooth replacements that we use to replace teeth, whether it be a single tooth or dentures or a full mouth of teeth.
Because I told my family that I was going to be with a doctor on the radio talking about implants, and I got this funny look.
Oh, yeah.
But it's not that.
It's not those kind of implants.
No, not those kind of. That's, again, another show, another day, and
Absolutely.
another dollar. So if somebody comes to see you, number one, they don't need a referral from their local dentist, do they?
They don't. That being said, we have a referral-based practice. We have a lot of colleagues we work with, and we're really appreciative of that. But we do have an office where you can walk in the front door, or you can call us and come in for a complimentary consultation.
Just like Barry did, who heard us on the radio talking about implants and teeth care. And
Absolutely.
He called you up and came down.
Absolutely. He came in, and we were able to sit down and talk to him about things and get it done.
We just had his wife, Marianne, on the air a little while ago, and she's so pleased that he went to see you.
Well, I'm glad. It's the best part of being in this profession and doing this kind of work is when people are happy. When people are happy with what they've had done and they're appreciative, and more than anything else, when you feel that they've really changed kind of how they feel or what they're doing, it's the best part.
It's not just having your teeth fixed, which of course is very, very, very important because you got to keep your face full of teeth. But it's also lifestyle we're talking about.
Oh, it's huge. Like especially for things like whether it be cosmetic work or implants or teeth in one day, where we change someone's the way they look, where they eat, where they smile. It changes their confidence. It changes how they feel about themselves every day, and it really changes kind of how they live their life. It's pretty amazing. And I'm not here to say I change lives every day, but what I'm saying is that it's something that really, really changes the way they feel about themselves, and that's a big deal. Either living with pain or worrying about not smiling too wide, or worrying about when you're biting into something, when you're eating something, if something's going to break, or is my denture going to fall out or move. Those kinds of things. There's always something that we've done to help alter and change that, which is great.
I think we all know somebody who smiles but the hand comes up in front of the face or a book or whatever, right?
Yeah, absolutely.
Yeah,
absolutely.
So this really is about lifestyle and confidence.
Yeah, confidence is huge. It's so much more about confidence and how you live your life and how you feel confident about facing life every day. That really helps, I'm telling you.
If I had known you earlier in my career, I could have gone to seeing you and I could have been a star on television instead of just doing radio all the time.
I think it worked out pretty good for you, I think.
It's okay. It could be worse. We're talking with Dr. Bobby Birdie. I'm Tom Lucas. You're listening to the BoomerLife show right here on AM 650. And I think we're going to have an opportunity now to speak. Is it with Jason? Jason is another one of your patients.
Sure.
Jason, good morning.
Hi, how you doing?
I'm good. How are you doing?
Good. Another fine, gorgeous, sunny day in Vancouver.
Couldn't think of a better place to be, I'm telling you. So now you have gone to see Dr. Birdie, right?
Yeah, I have.
And can I get personal? Can I ask you why you did that?
Well, I actually saw Dr. Birdie's reviews a little bit online because I'm kind of like a little bit of a internet buff there. So I kind of searched up a doctor that I wanted to come and see. And then I heard about Dr. Birdie off of another dentist before, so I looked him up online, and he looked like he was a genuine guy, and I searched his website, and I read a little bit about him, and it just kind of, made sense a little bit, so I decided to go in and see him.
So you thought you'd check him out?
Mm-hmm.
Yeah.
And you did, and what did you think?
When I went to go see, it was great. Like, he was very personable. He's very talkative. He explained things in simple terms. Like, I've gone to see dentists before, and they use terminology at times that you don't really understand. And you're always, sitting there wondering, well, I don't really know what that means, but you don't want to keep asking more and more questions.
Absolutely.
Right? So that gets a little bit uncomfortable. But when I was talking to Dr. Birdie, I didn't actually feel that at all. Like, it was just, he was explaining it to me in terms that I would understand, and it would just make sense. And there was no, trying to use big words or anything like that. It was just plain and simple. This is what it is. This is what we're going to do to fix it. And this is what the end result's going to be like, or that's what we're hoping our end results are going to be like, and so forth.
Well, Jason, what you're saying is so true, because if I go to the doctor or the dentist and he starts using all these fancy terms, I just go, huh?
Yeah.
What? Huh?
And then after a while, you just agree. You're like, okay, yeah, let's just go on.
Oh, jeez. Listen, when you go to see the dentist, don't agree to anything. Ask him to explain it 5 times to you before you agree to it. But
Exactly.
Dr. Bobby Birdie explained things properly to you, right?
Yeah, it was plain and simple, right? What I had was, I had a little bit of a cosmetic thing that was happening in the front of my tooth. My tooth was overlapping with another one. And it does, when I would eat, and it would kind of, obstruct the eating process too, because a lot of food would get stuck in it, and it wasn't very comfortable. And he noticed that it was also chipping a portion of my inside of my lip and stuff. So he did the procedure for me, and it was absolutely perfect. And it just, I haven't had any problems since, and it just made sense.
You getting a little more action these days? Just kidding. Just kidding. So if there's somebody who's listening to the show today and they're thinking, well, this sounds really dandy, would you suggest that they perhaps do get in touch with the doctor?
Definitely. Like, I've already referred him. Like, my mom's gone to go see him also. My girlfriend's gone to go see him also. One of my really good friends, his dad had some tooth work done, and then he's been in agony for about months and months at a time. And then I told him, like, you should really go see this guy, and, he'll be really good. I think after 1 or 2 consultations with him, and they just figured it out, and I talked to him about a month ago, and he's like, dude, my dad's never been happier, and I swear to God, I don't think I'm going to another dentist ever again. Right? So I'm pretty sure Dr. Birdie would remember his case, too, and it was a really complicated one at that period of point. I don't know if I really should mention people's names online, but
that's okay. You know what? And I can't wait to see your Christmas picture, the whole family, they're all their pearly whites just smiling away there.
Yeah. Definitely.
No, it's been good. It's called. I think it's been great seeing Jason and seeing his mom and like I said before, and one of his friends and his friend's dad. It's been great. The best part about it is being able to see people and see people when they get the work done and they're happy with it. It's great. And Jason, I think your mom needed a lot of work done. She's getting a lot of implants and a lot of things done too, and she's had a lot of work done overseas, right?
Yeah, she has. She's gotten a lot of work done over the years, and it just hasn't been right, and it hasn't been sitting right. And she's getting a lot of work done with Dr. Birdie too. I think this is like she's already gone in for phase 2, and I think there's like phase 3 and 4 still pending.
Yeah.
But at the end of the day, she's really happy, and she likes the way her mouth is looking more and more and more as she goes along. And I can notice her smiling more in her photos because more and more of her teeth are coming into place to let her smile a little bit more with confidence, like you guys were talking about earlier.
Yeah, and Jason, too, like we said on the show, we've said this numerous times, too, about what Dr. Birdie is doing is giving you a brand new lifestyle.
It truly is. Like, when you start looking at people and they start, like, looking at your face, you don't get self-conscious anymore. You don't worry about, like you said earlier, putting a book in front of your face or something along that line. You just are up and honest about it, right? And you're just there, and people represent you better, and you represent yourself better, and it truly does give you a lot of confidence.
Let me put you on the spot here. Okay. I'm going to ask you to give some advice to people who might be thinking about this but are a little bit nervous to maybe give Dr. Bobby a call.
Okay.
What do you suggest they do?
I would say give it a try. What do you got to lose? He's not charging you money to come see him. He's not charging you anything to have a consultation. And if anything else, at least a second set of eyes could always help.
That's
right?
true.
That's my opinion.
And not only that, he's got a great office, brand new office.
Yeah.
And
his new office is absolutely gorgeous. Like, that place is like you're walking into one of those multi-billionaire spas that you walk into. You're looking at a great view and you're sitting on these amazing-ass chairs. Yeah.
I just used to go down there and just hang out when they asked me to move on because I was taking a place that a patient could have. So, and the coffee's pretty darn good too, and it's free.
Yeah.
There's coffee, there's
Definitely.
tea, there's water, there's everything a guy or a girl needs down there, right?
Mm-hmm.
Yeah, definitely.
Well, Jason,
that's what I would say. I would say, like, go in. I know everybody has hesitation for going to the doctor or especially the dentist, but what are you going to lose? You're not going to lose anything out of it. At the end of the day, if you feel like you can't do it, you can't do it, right? But at least you got a second set of eyes to look at it. You actually got an honest opinion and somebody that's explaining it to you in plain English.
like you say, what can you lose?
Absolutely.
Yeah.
Well, Jason, what's on tap for the rest of the weekend? Just go out and smile at people now, or?
Basically, try to hit up the beach a little bit, make really good use of this smile.
Get down to the beach and see who you can impress with that big, pearly white smile of yours.
Definitely.
Thank you for being with us. You're a good sport.
Not a problem.
We really appreciate your time, Jason. Thank you so much.
Sure. Take care.
Bye-bye now.
Bye-bye.
Man, you're a magician.
I'm not a magician. These people are just nice.
You are. No, you are. These people, we've had 3 of your patients on the phone, and not one of them has said anything negative about you. They're all just, they love you, man.
Well, it's good. I'm happy about it. I just, it's good to be able to provide good care and for people to be happy with what they're doing, and it's nice and it's flattering beyond means. Absolutely.
Let's do this. Let's take a quick break, and when we come back, we'll talk about who might be a good candidate for dental implants. Okay?
Sure.
All right. Hey, thank you for joining us this morning. You're listening to Boomer Life on AM 650 Radio. This is Tom Lucas, and our special guest in studio this morning is Dr. Bobby Birdie. We have more coming right up.
It's all about the baby boomer lifestyle. Boomer Life on AM 650.